Thank you, General. Mr. Chairman. Dr. Clancy, I serve on a constituency that actually has a Veterans Hospital, the Lake City facility, and there's testimony here that we did not read aloud, but I think you're familiar with, that they had a problem in the Lake City facility recently with a nurse misappropriating the drugs. Can you discuss the corrective actions and protocols that have been established at that Lake City facility in the wake of this incident to restore the quality of care and the level of workplace safety for the community, and also tell me if your current controlled substance coordinator in that facility is properly certified and educated on the management of controlled substances and the supply chain and the management policies.
I would be happy to take that for the record. Our first focus was on protecting patients and then holding the individual accountable, but I will get the rest of the information.
Okay, so you're not familiar with that particular incident in the Lake City facility?
I am familiar with the incident. I'm not familiar with all the details of the follow-up, but we will find that for you.
All right. Let me depart for a second. Dr. Burge, you're an expert in substance abuse, I think, and how it comes to pass. I'm a surgeon. And I've managed operating rooms. I've directed hospitals and large clinics, and this is a problem we all have to address. It's just part of the job that we have to do when we do healthcare, and I've seen this studied at the state level as well. I'm looking at this particular pie chart here that suggests that 90% of the problem with diversion with controlled substances is occurring not in the healthcare facilities, but in the United States Postal Service and in UPS. Now, I'm going to tell you that I've looked at a lot of drug diversion, a lot of problems with this in my 35-year career as a surgeon. I have never seen anything like this reported. This is perilously close to the old excuse, the dog ate my homework. Do you believe that 90% of the problem with drug diversion in this country occurs in the United States Postal Service?
I'm not really qualified to comment on that because that's not where we see it. I'm basically assigned to within the wall of our facility. So what happens without, I don't know. That's not what we see at Mayo. We see other forms of diversion.
Perhaps I should redirect that question to Dr. Clancy and say, do you mean by this that the 90% of the problem occurs in the Veterans Administration facility mail rooms? Or do you actually saying that employees of the United States Postal Service and United Parcel Service or people who victimize them are getting 90% of the diverted drugs?
Sorry. What I am saying, and I'll ask my colleague to elaborate, is that between the time the prescriptions are put in an envelope, and understand that we have a central mail order pharmacy, which for most prescriptions works extraordinarily well. It does a high order business, very large volumes. Somewhere between there and the veteran's home where it was supposed to go is where it is diverted. On occasion, we've heard from veterans that that's actually diverted by a family member and so forth, but it could be any one of those points, and that's where working with the Inspector General, VA Police, and outside law enforcement has been very helpful. Okay, so let's drill down on this a little bit farther, because this looked like we were laying it off on the Postal Service. What's happening is the VA is getting receipt of the drugs from who they purchase it from, and then they're distributing it in their system. Now, they may be using UPS or USPS, and somewhere between once the VA has the drug and the VA passes it off to another part of the VA, the drugs are being diverted. Is that the system? No, this is outside the VHA system. So I have to tell you, I've 35 years, I've never heard this kind of accusation. 90% of the problems in the postal system. I'm flabbergasted, Mr. Chairman. Let the records reflect my incredulity.
Dr. Dunn, we looked at this. One of the first things that we tried to obtain was good data. I'd be very suspicious of those too, because losses are not always synonymous with diversion. So we got to be careful of that. But the reporting system, VA doesn't have a very good reporting system for drug diversion cases. So I would just be very suspicious of any data.
I am too. Thank you.
Thank you.